The Department of Justice releasing its remaining documents from the Jeffrey Epstein investigation. Deputy Attorney General Todd Bland saying the records will be posted throughout the day, including more than 2,000 videos, more than 180,000 images, some of the material so explicit you have to verify being an adult before you can actually access it.
Hi, I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So before we begin today, we want to offer a brief content advisory. Some of the segments that we're going to discuss today have sexual violence, exploitation of minors, and systemic failures that should have protected children. So please take care of yourself while you're listening and watching today. This conversation is not political. It's not sensational. It is a conversation that we need to have within healthcare. It's grounded in evidence, ethics, and accountability. Because when medicine fails to act on what it sees, harm doesn't happen by accident. It happens by design. Let's roll this clip.
And on Epstein, Trump's comment to New York Magazine in 2002 stands out today. He gave that comment around the time period covered in today's indictment. The president said this, quote, "I've known Jeff for 15 years. Terrific guy. He's a lot of fun to be with." It is even said that he likes beautiful women as much as I do, and many of them are on the younger side. No doubt about it. Jeffrey enjoys his social life.
So he likes them young, is what he was saying. And I think, Dr. Brown, birds of a feather flock together. So I believe this deserves a huge sigh currently of what we've seen this week in politics.
There's the sigh. It's pretty big.
It is.
Right?
Yeah.
Dr. Sloan, this is a hard conversation because what we're examining today is not just a story of Jeffrey Epstein. It's a case study in how warning signs were ignored and how systems hesitated and how medical responsibility was repeatedly deferred. And that's while children were harmed. And there were clear signals. And in healthcare, those signals are meant to trigger action. And this week, the Department of Justice released some 3 million pages, including 2,000 videos, 180,000 images. But what they did not release were identifiable info about the victims, or so they said, depictions of child sex abuse, files related to active probes or cases, and images of death or physical abuse. One of the most uncomfortable truths about this case is that nothing about it was subtle. Right? There were repeated patterns, there were consistent reports, and there were multiple points of contact where intervention could and should have occurred. So when we talk about centering women and girls and boys in our healthcare, this is what the question demands of us. It means listening to voices that are routinely dismissed. It means taking minors seriously when they present with injuries, infections, or trauma, especially when those presentations repeat. So public health research has been unequivocal on this point. Girls and boys who are exposed to sexual exploitation and trafficking face extraordinarily high risks of long-term physical and psychological harm. And those risks don't disappear with time. They actually compound exponentially. And that brings us up to this really critical question, which is who is responsible for speaking up? Let's roll the clip.
I was involved with Jeffrey for about 3.5 years.
Courtney Wild was just 14 when a friend convinced her to go to Palm Beach and give massages to Jeffrey Epstein. Massages that immediately turned into sexual abuse.
One of the main questions that somebody always asks me is, well, why'd you go back? Why'd you go?
Courtney was from a lower income, broken family home. The lure of $200 for each massage was one reason.
$200 is not a lot of money. However, to a 14-year-old that doesn't have $200, it is. So
she was also awed by the wealthy and fabulous lifestyle Epstein flaunted.
When you go over the bridge to Palm Beach, you could kind of just feel the wealth and the power along with the beautiful views.
But as she got a little older, Courtney began to feel shame and guilt and blame herself for her abuse at the hands of Epstein, something all of his victims experienced to some extent.
Yeah, so who is responsible for speaking up for minors? And in healthcare, the answer is very clear. It's physicians, it's nurses, and other clinicians that are mandated reporters. So a lot of people are asking, what is a mandated reporter? That is a professional who, by law, must report reasonable suspicion of abuse, neglect, or exploitation of a child to CPS or Child Protective Services and or law enforcement. And so exactly who are the mandated reporters in the United States? So that includes physicians, surgeons, nurses, nurse practitioners, physician assistants, as well as mental health care professionals, social workers, teachers, school staff, child care providers, athletic trainers and coaches, and sometimes in some states, even clergy. So what exactly triggers this report? When should you be looking to report? If there is reasonable suspicion, not proof, reasonable suspicion. So those triggers could be unexplained or repeated injuries, sexually transmitted infections in minors, a recurrent genitourinary complaints, inconsistent or changing histories, and a behavior that is, equivocal to fear or withdrawal, or even sexual behavior that is inappropriate for that age. And so why does this all matter? It's not because you need confirmation. It's not that that person has to investigate. And you do not get to decide if the person is guilty or not. Your role is just to report what has happened. And why does that matter in medicine specifically? Because mandated reporting specifically exists for us, but also to protect a child who can't legally consent. It also exists because abuse is often hidden, as we have seen with the Epstein files. And more importantly, early reporting could possibly prevent ongoing harm to a child who doesn't know or can protect themselves against adults. So what happens when medical professionals or others on the mandated reporting list fail to report? It results in, for us, legal penalties like fines or loss of your licensure, or even criminal charges in some states. But it's an ethical violation of who we are and the oath that we gave to medicine. And the worst consequence of all is there's continued harm to the victim, as we've seen in the Epstein files. So the obligation is not discretionary. We don't get to pick and choose what we do and what we report. It exists precisely because children cannot protect themselves. And when the responsibility is ignored, or even worse, delayed, the consequences are not theoretical. Dr. Brown, these are measurable.
To understand why consent is impossible in these cases, we actually need to ground this discussion in some science. And so it's according to the NIH and, of course, neurodevelopmental studies, they all consistently show that the adolescent brain is still developing well into the mid-20s. So the regions that are responsible for judgment, impulse control, and risk assessment are not fully formed. So these minors cannot even really evaluate risk the way that adults can. They cannot meaningfully consent to sexual activity with adults, and especially in the presence of consent where you have this power imbalance and coercion and manipulation. And that's not ideology, right? That's settled science. And this whole process of grooming has been studied extensively. According to RAIN, grooming starts with just building the trust. You're targeting a vulnerable child, securing access and isolation, gaining trust. And then there's this controlling and concealing this relationship, not just from the child, but from the adults that are responsible for their safety. And that doesn't just happen one time. It happens over weeks and months and years. The abuser actually creates these ideal situations where they can commit the abuse without detection. And even the American Academy of Pediatrics and all of our trauma research literature really describes it as this deliberate process where boundaries are violated and the victims become completely controlled. And when you combine that with fear, financial dependence, authority, consent's impossible. So the problem is that with grooming, they actually manipulate the caregiver's perceptions and they condition the child to comply, and then they delay or prevent the future. So when we talk about protecting children, we have to see grooming for what it is and what our roles are as mandated reporters. We know, as Dr. Sloan said, that there are higher rates of infection and musculoskeletal pain, pelvic pain, psychological complaints like depression, anxiety, suicidality. These are not transient findings. Research shows these conditions persist for decades. This is a long-term medical injury, Dr. Sloan.
Yeah, I agree that I believe we need to talk about the language, right? So this is where we mess up sometimes in medicine, because language does shape the accountability. And so let's name it. Let's call it what it is. This is not sex with an underage girl or boy. It is rape, plain and simple. Statutory rape at the minimal, right? It's not rhetoric. This is legal and medical definition. Rape. It's a child. They can't consent. So anything less minimizes harm and protects who? The perpetrator. So once we name the harm accurately, we must confront the next question. Who failed to intervene? And again, medical professionals are mandated reporters, right? We missed the mark somehow. That includes physicians across all specialties. And according to federal law and state statutes, repeated infections, unexplained injuries, bruising, inconsistent histories in a minor require further investigation and evaluation and reporting. So when these signs appear repeatedly, action is required on our part as medical professionals. Had earlier reports been meaningfully investigated, years of additional abuse could have been prevented. Prayerfully is what I believe that is. And that is not a hindsight. That's just the system failure, because this abuse was not hidden. People saw, you guys, these children being transported. Clinicians treated the same adolescents repeatedly. Dare I say, Dr. Attia? But there were bruisings, there were patterns, there were marks. And in medicine, when you see patterns, that demands a response, Dr. Brown.
And one more thing must be said, which is that this coercion doesn't end in childhood, right? In the Epstein cases, the victims were not only children, they were adults, vulnerable adults that were subjected to the same tactics, whether it's the power, that control, the isolation, the fear. And that's the point, right? So even as mandated reporters, it's not limited by age, right? Abuse does not become acceptable at 18, and our responsibility does not disappear. And so for those of us in healthcare, especially in orthopedics, this brings this issue uncomfortably home. Because like Dr. Sloan and myself, we see this, or as one of the great giants in orthopedics has said, to paraphrase, you may not have seen it, but it has seen you. And the data backs that up, right? So the February 2026 issue the Journal of Bone and Joint Surgery actually just published a major study, one of many, that's actually showing intimate partner violence, and that it's pervasive across all genders, particularly in our orthopedic trauma patients. We know that patients that have IPV, they have worse outcomes. It's whether they're not going to return to work or whether they are not even getting to their prior level of function. And let me tell you why this matters. It matters because we orthopedic surgeons, ER doctors, we're some of the first that the contact of abuse. We see fractures that don't align with explanations. We see escalating injury patterns. We see repeat visits with vague or shifting stories. And that means that we are positioned to intervene. And we must be the first witness. We are those mandated reporters. And that makes trauma-informed care essential. We need to recognize that the signs of trauma, and we have to respond appropriately and avoid re-traumatizing these poor victims. So it's important to understand that silence and fear or fragmented narratives are clinical signals. They're not just credibility flaws, and it requires action, not silence, not deferral, not rationalization, because neutrality in the face of abuse is not neutrality at all. It is complicity. Thoughts, Dr. Sloan?
I think the hard truth here is not about just one individual. It's about the fact that the whole collective failure here. The victims didn't fail the system failed them. And accountability, real accountability, must follow right now. So yeah, us centering women and girls and boys in healthcare means believing them the first time, means protecting the most vulnerable, even when it's uncomfortable. And it means understanding that our ethical duty does not end at just a diagnosis. It begins there. So as healthcare professionals, we identify that the system has failed over and over again. We are demanding answers and accountability because the evidence matters, ethics matter, and so do the lives of those who are forever altered by what has happened to them. So when systems choose inaction, specifically the medical system, it's a problem, Dr. Brown.
We know it's a lot. This segment is a lot. We want you to keep your eyes open, stay alert, stay disruptive, and remember that your voice matters. We are Aya, contributors to the MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.